Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
More than 30 million men in the U.S. are living with erectile dysfunction. Heart disease and diabetes are two of the major risk factors, but unfortunately, the biggest risk factor is age, and you can't do much about that. More than half of men who are age 50 experience ED, and the number jumps to 70% at age 70. I guess that's not too surprising. Remember, Dr. Joyner just a few weeks ago told us that 50% of 70-year-olds can't get off the floor.
Yeah. How old are you again? We're going to talk about that? Okay.
Not telling.
While ED statistics increase with age, men don't have to live with ED. There are treatment options available. For many men, a physical exam and a medical history are all that's needed for a doctor to diagnose ED and recommend a treatment. Treatments can range from lifestyle changes to oral medications to surgical interventions such as penile implants. Here to discuss treatment for ED is Mayo Clinic urologist Dr. Toby Kohler. Welcome back to the program, Dr. Kohler. We love having you here.
Hello again. Thank you for having me back.
So much to talk about when it comes to the Mayo, isn't there?
That's right. Very important information.
And this is a tough problem because it affects so many individuals. Everybody's living longer, and the statistics show that 70% of men age 70 have a problem with erectile. Erectile dysfunction.
That's true. So, if you're 50 and you're in the football game, you look to your left or your right, one of those two guys is going to have a problem. So very pervasive, very common, and also an indicator of other underlying problems like heart disease sometimes. So that's why it's really important that we not only look into it and investigate it, but look for the underlying cause to treat it.
So what's the relationship there? You said it could be indicative of, for example, heart disease. How are they related?
Yeah, so, the penis is essentially the canary in the coal mine, as we like to say. The blood vessels that feed the penis are about 2 millimeters in diameter, and the blood vessels in the heart are about 4 millimeters in diameter. So whenever you have problems with blood flow to areas, the penis will act first because the vessels are smaller. So if the canary stops singing, there's a problem impending for the heart, right? Because heart attacks are common and can occur. So if you look at statistics, actually, in men age 40 to 50, the strongest predictor of heart disease is erectile dysfunction.
No kidding.
Why is it
the canary stop singing? That's such a great way to put it. And if you don't like the term ED, you've got another way to tell it like it is.
Well, here's my question then. I mean, I suppose the answer is obvious, but if so many men experience erectile dysfunction, why is it so hard for them to come in and talk to their doctors about it?
Well,
just one of those things.
It's one of those things. Well, first of all, it's hard to get guys going to the doctor for any problem.
Got it.
But then, of course, it's a sensitive area. People are embarrassed. We often get the hand on the doorknob approach. So they'll list a litany of other complaints. And then as we're trying to leave, then they'll bring up this last thing. You have to have confidence. You have to go in there and say, Doc, I've got a problem with sex. What can we do about it?
Well, shouldn't primary care doctors then? I mean, if this is something that's so pervasive, wouldn't it just be something that they talk about when it comes to their patients?
Yeah, I think that's a very good plan. And that's, what your primary care doctor should be doing, actually. In age 40s and 50s, both men and women, sexual dysfunction will relate to depression, it will relate to heart disease, will relate to diabetes, all these other things. So those organs are very sensitive predictors of other problems.
So we've got a lot of medical options, which we didn't have before the medications came on the market to help with erectile dysfunction. They're pretty effective?
Yeah. Well, before we even talk about medications, we should first talk about lifestyle changes. So again,
always
it's always lifestyle changes. Like if you exercise and eat right, everything gets better. I mean, that's the bottom line. A lot of the stuff we do in medicine is a Band-Aid to allow you to exercise and eat better, like heart stents, for example. But if you lose weight, if you quit smoking, if you have a slimmer waistline, your penis will be better. I mean, I think, honestly, the cigarette carton should say, this is bad for your penis, and then less people would buy cigarettes. And indeed, in Canada, the picture on the side of the carton is like a kind of flaccid cigarette.
Oh my
configuration.
gosh.
Yep, they actually do tap into that.
Wow.
So smoking, obviously a huge risk factor.
Very bad. And as soon as you
dysfunction.
quit, you have as an effective improvement as if taking pills.
All right, but we've got this medical option, and I assume for some people it doesn't work or stops working over time, and then you've got some other things you can do.
Yeah, so lifestyle doesn't work, and then you can try sometimes pills. Pills will work in 50% of men, but they will stop working after about 5 years. Not because you get immune to the pills, but because you get sicker. The blood vessels get more clogged, other medical problems, rear their ugly head. So
Now that's interesting. Did I hear you say that the pills, on average, work for just 5 years?
Yes.
And then the disease gets bad enough that even the medicine doesn't help.
Correct. Okay. Exactly right.
And then what do you do?
Well, then you've got essentially two options left that potentially could work. One is giving yourself injections into the penis, which sounds scary and painful and horrible, but is actually very doable and works. Or you can do a surgery. The surgery is called...
Now, the injection, what do you inject?
You inject Viagra or, these oral medication-like medicines directly into the penis, and they're much more effective because they're in higher quantities.
Big needle or...
Tiny needle. Diabetes needle. Tiny needle. Most guys rate their pain on a scale of 1 out of 10, 10 being I just got hit by a truck, at 1.5.
Okay. And then that doesn't work, or somebody doesn't want to do that,
Correct.
Which would be understandable.
Yes. Then we can do surgery. So, you got to think of the penis like a bike tire. So...
a canary and a bike tire.
There you go, both at the same time. So the bike tire analogy is obviously somebody has to pump air into the tire for it to work, right? So that's blood flowing in there in the analogy. And so if the pump is broken, if the line going to the tire is broken, i.e. cholesterol blocking the flow, then you can have problems with erections. The other thing that has to be good in the bike tire analogy is the liner of the bike tire has to be intact. So there's something called venous leak in the penis that diabetics get, where blood flows in, but it can't be trapped in the penis like it's supposed to, so then you can't keep your erection. So again, what we do for the surgery is we replace the need for somebody to have to pump air in, and we put an interior liner inside the penis. So that's a device, so that when you want to have sex, essentially the patient manually pumps fluid or normal saline into the device in that same space where blood used to flow, but now you're putting that fluid. These devices, when you think about it, nobody knows you actually have it. So there's nothing outside the body. It's completely concealed. It's locker room proof, as we say. And it's highly effective and has the highest satisfaction rate of any treatment that we have for problems with erections.
Are there risks with this implant?
There are risks, like with any other surgery. But on the whole, they're less than 3 to 5%. There's less than 3 to 5% chance of something going wrong, but you can get an infection of the device. The device can break. Interestingly, these devices last longer than hips, knees, breast implants, pacemakers. They're the longest lasting medical implants we have.
No kidding.
And
lasts longer than your total hip or your total knee. Now that's that's good.
And is it covered by insurance?
It is. It is. So it's covered by Medicare. There's a government mandate for breast implants to be covered after breast cancer surgery in women, and similarly in men after prostate cancer surgery, etc. It's paid for to restore normal function.
All right, perfect. If you want the canary to sing, surgery might be an option, a penile implant. Treatment options for the common problem of ED with Mayo Clinic urologist Dr. Toby Kohler. Dr. Kohler, thanks so much for all the great information.
Thanks for having me.